COVID-19 has impacted the way we do a lot of things, including how the City of Denver protects and shelters its most vulnerable residents. Denver's Department of Housing Stability, or HOST, responded to this pandemic by leveraging partnerships with service providers to offer around-the-clock shelter at existing facilities, new auxiliary shelters, and hotel rooms. Across these facilities, we are offering shelter, medical support, and other services to more than 2,200 men and women each night. Here's what you need to know about how HOST is working to change the system and outcomes for people experiencing homelessness.
I would ask you to reframe how you think about the issue of homelessness. Homelessness is a context that people are living in. It is not who a person is. Hi, I'm Britta Fisher, and I'm the Executive Director of the Department of Housing Stability for the City and County of Denver. So here in the City and County of Denver, we look at housing across a whole continuum, from people experiencing homelessness to people at about the median income or the middle point of incomes in our community. More than 100,000 of our households that are under the median income are struggling with their housing costs. They're feeling cost burdened. That means they're spending more than 30% of their income on housing. What we also see is that about 46,000 plus households are spending more than half their income on housing. And when you're cost burdened or severely housing cost burdened, it's hard to afford other necessities, things like medicine and food and transportation. And so we know that here in Denver, we want people to be able to afford and have a healthy and successful and connected life across our housing and income continuum.
You know, I just believe every single person in Denver deserves to be healthy, housed, and connected. And that's why we created this office. You know, there is no bigger priority for me as mayor or us as a city than addressing the needs of our most vulnerable residents.
So here in the city of Denver, we have about 320,000 dwelling units or households that can be housed here in the city and county of Denver. Of those, about 23,000, a little more than that, are income restricted units. And what that means is that those are restricted for people at or below that median income at different price points so that is affordable housing. It is income restricted based on what a person can afford. That equates to about 7% of our housing stock here in Denver. Our vision for the Department of Housing Stability is really to align our work to the outcomes we're seeking for the residents of Denver. The mayor's vision is really housing stability for all.
I can't emphasize enough the importance of stabilizing people where they are. You know, intervention at that critical time can prevent a difficult situation from turning into something dire.
Some people are trying to resolve their episode of homelessness, so that's homelessness resolution. We want to help quickly get them to the crisis supports that they need, as well as to housing as quickly as possible. We also need housing opportunities. So how do we create and preserve housing here in Denver and then provide meaningful access to that? And then finally, undergirding all of that is housing stability. Housing stability is keeping people in the homes they're already in, as well as helping to prevent involuntary displacement to the best of our ability. Helping out with a couple months of rent or something like that is much more cost effective than building a new $300,000 apartment. We know that it's not just enough to be housed, but we need to work on that whole health for a family, for an individual, and how we are connected into our community, because we as humans are meant to be in community with one another.
Me and my wife separated, so when I ran out of money, I ended up out here on the streets. But it was the worst experience of my life.
So I'm going to let you take in this cartoon for a moment. And as you read that and you look at those individual tents as depicted, and you see what the federal government is saying and as depicted by Uncle Sam, and you have our mayors of the U.S. sitting next to that, what I'd like you to take away is that the people experiencing homelessness are as diverse as people. This is not a monolith. There is not the homeless. There is each person who is experiencing homelessness, and each has their own story as to what happened to them and how they found themselves in this situation or context that they're living in. Homeless is a context. It is not a group. Homelessness is both a symptom of and a cause of trauma. Up to 92% of people experiencing homelessness had a significant experience of trauma as a child. We need to stop asking, what's wrong with you, and rather be asking, what happened to you? Everybody needs a support network, and often what we see in each person that's experiencing homelessness is they've had some rip or tear to that support network. So showing up for the people that you know, that you care about, that is one of the best things that you can do. For me, the bottom line of this cartoon is that people experiencing homelessness each has their own story. Each needs a customized, tailored solution for what is going to meet their needs. While we know that for each person there's a unique story, we do see certain themes. Trying to escape violence. Whether it's partner violence, domestic violence, or the violence of their area, there are people that are trying to escape that, and that results in a housing crisis that they sometimes can mitigate in some ways and other times ends up being in the context of homelessness. We also see another theme for those who are battling health issues, whether they're trying to take care of a loved one who desperately needs their help or battling with their own health issues. It can be incredibly costly, and when people have to choose between health and housing, it's a very tough thing. And so it often ends up with a housing crisis.
I know what it's like to be separated from family members in a housing crisis. I don't want any family to experience the pain of the choices a parent or a partner may be forced to make. And that's why stability is in the name of this agency, and stabilizing someone's circumstances is simply a smarter and more effective way of addressing a housing crisis.
And then finally, I think one of the top issues that we must acknowledge as a community is the racial disparities that we have had in the area of housing. Those identifying as Black or African American are showing up more than twice as much in our population of people experiencing homelessness than they are in our general population. We also see that overrepresentation for First Nations, for those identifying with multiple races. And we need to notice that as a community and address that. You see this disconnect between the income stagnation and those housing costs. Housing costs have gone up about 60%, and incomes have gone up 5%. The philosophy of the 1980s was that the dollars would trickle down from a booming economy. It clearly has not trickled down to everyone.
Congratulations, everyone.
You know, raising the minimum wage was the right thing to do. I can't tell you. To help our residents begin to address the huge disparity between rising home costs and stagnated wages, we had to do them together.
And this was a way to increase incomes for people who are working hard in our community.
Just like there's no one reason a person finds themselves in the context of homelessness, there's no one single approach that can address it.
The solution to homelessness is housing. By definition, if we give somebody who has lacked a home, they are no longer experiencing homelessness. Housing plus services works. And when we are talking about this continuum, we need to remember that there is definitely a place for emergency shelter. But we are looking to transform our sheltering system here in Denver from an emergency overnight crisis response to one that's more residential in nature. What I mean by that is that we were trying to make sure people were warm, dry, and safe. And that is a laudable goal. But we have seen that crisis occur every night for decades. How about we start transforming that really towards a model of 24/7 access, of residential sheltering where people know that they can store their belongings safely and securely, where they know that they have a bed that they can return to each day, where they feel that they are stabilized in a space where they can then address other issues, where they are not queuing or standing in line most of their day in order to get transportation to a place where they can get a bed, food, and other necessities, but rather that those things are generally provided for and stabilized so they can then move on to addressing other areas of their health, work life, and their life for the future.
By putting a roof over my head, it took out the wondering where I was going to sleep out of the equation entirely. And that allowed me to start getting sober.
We as a community do not have enough units that we can get everybody inside. And so sheltering provides an option. And if we can convert that to more stabilizing spaces that are now part of a rehousing system, that this is now designed in such a way that shelter is the place where you go to get triage for your housing crisis and then get connected as quickly as possible to longer-term housing supports and services. That's the type of transformation that we see here in Denver. And we think about the genesis of Housing First, both nationally and internationally. It came largely from the idea that managing homelessness outside is largely ineffective. It takes a lot of resources, and when somebody stays outside, it is very hard for them to get healthy, for them to be stabilized, for them to feel that they have that stable foundation from which to build upon. And so the idea was to get people into housing and then address those other concerns. And this has been largely proven out time and time again, including here in Denver. It works. Housing plus services work. Housing First works.
I feel more secure now, that I'm here. And I'm going to do everything to make sure I stay here.
Back to normal, like everybody else.
As Bretta just said, that starts with a Housing First approach. And we're bringing every resource we have to bear in a compassionate effort to get residents in crisis the housing and supportive care they need.
When we took some of these hardest cases who hadn't been reached by our current sheltering system and homeless services overall, 85% of them, with those services and supports, remained housed 2 years later. 85%. That was a much better use of our taxpayer dollars and our investor dollars than having those most expensive interventions of jail beds and hospital beds.
They scanned my card. On the screen popped up, you have housing. Jump for joy. Yeah, I felt relief.
When we have told someone, we have housing for you, what we heard was, all right, let me find and access that housing and I'm coming with you. What we didn't find was that people would say no. In fact, only one person did. With only one out of more than 300 served, it's largely a myth that people choose to be outside. Because when they have meaningful access to that housing, they will come inside. Housing First is less traumatic and more cost effective.
For me, it was the golden ticket. I didn't know what it entailed, but it turned out to be the golden ticket.
The guiding source for us is one that's called the Point in Time Study. And the Point in Time is an annual census of people experiencing homelessness. So on one night and day in January every year, people are counted. Volunteers and staff members go out and count people experiencing homelessness by asking them where they spent the night before, and we get a tally of those who have been sheltered, those who are in safe havens or transitional housing, and those who've been unsheltered. When we look at the point in time numbers compared to the population of Denver, it almost doesn't feel right to people when they look at it. I think we know that there's been tremendous growth in the population of Denver, but there has not been the same pace of growth in people experiencing homelessness as counted in the point in time. It's actually been a little less. And so when you look at that number, that doesn't necessarily feel right for folks because they see so much visibility to people experiencing homelessness in our community. And so when people are sheltered at night and must empty the shelter in the morning, That means they're going out about their day, accessing their jobs, their services, their community in a way where they are carrying most of their life's possessions with them. And so it's hard for people to distinguish between who is sheltered and who is unsheltered. And when we are making those judgments about what we see and making kind of broadcast judgments, we're forgetting about the person-centered approach and that they may have been sheltered that night. The unsheltered population has actually been relatively flat. We've had around 600 or less people experiencing homelessness who are unsheltered. Again, it doesn't feel to people that it's been relatively flat. Of the people experiencing homelessness that were counted in 2019, about 80% were single adults, and about 20% were people within a family unit. More than 39% are struggling with substance misuse. We see more than 40% are experiencing some type of mental health issue that they need help to address. And so yes, those are in fact some characteristics that people will identify in persons experiencing homelessness, but it's important to note that because of the trauma of homelessness itself, it also contributes to and exacerbates some of those self-identified issues. This data should inform our approach to how we are serving people in our community. And there's great hope. We've seen some of our investments paying off here in Denver. One of our programs is Rapid Resolution, where we try to make somebody's first day experiencing homelessness their last. We try to rapidly resolve by paying for an alternator or spending less than $400 on a prescription or a ride to their social support network. That when we can do those things, we can really stop a housing crisis from spiraling into a much more traumatic experience. We also have made some big investments. Mayor Hancock announced in 2019 that we would be spending $15.7 million between private and public resources leveraged together to address shelter improvements, those day services, as well as bridge housing, helping people with that interim solution as they bridge to a longer-term solution. We have purchased a large shelter. We purchased Crossroads Shelter from Salvation Army to make sure that we weren't having a situation where we were without 500 plus beds. It represents a great way to stabilize our current shelter system, but also an opportunity for the future to transform towards more housing and residential shelter for the future. So we see investments in storage, in ADA accessibility, in the services and housing navigation and case management that it takes to support people in a housing crisis to navigate towards those stabilizing resources. We've talked about how housing first is more cost effective and less traumatic. When you see that the cost for services is anywhere between $7,000 to $15,000 a year for the highest acuity or those with the most service needs. What we see is when we are serving people with those same needs on the street, that it is much more costly. In fact, the state of Colorado estimated that each person that is experiencing chronic homelessness is costing almost $49,000 per year.
I'm saving up some money now, fixing my apartment up. I got families coming to visit me now, At first I couldn't do that.
To get people onto the path for housing stability, income and jobs is very important. And so one of the ways that we've innovated here at the City of Denver is to create a day labor program of our own called Denver Day Works. And it helps people who are experiencing homelessness start to get some of that solid job experience that they can then leverage into longer-term employment. Of the 232 participants that we had in Denver Day Works in 2019, 78 were able to utilize those wages to start accessing stabilized housing. We want to focus on people's strengths and not their weaknesses. We also want to have systems that work for each person rather than each person having to fit into the system.
And we are always looking for ways to level the playing field for our residents to not just survive, but to thrive in Denver.
Homeless is not a group. Homeless is a context. It is something that persons find themselves living in. It is not what defines them.
I'm a citizen again. I'm human, like the rest of the world. And I'm back to life again. I'm back in life.